Carlos. Today we had a very interesting mission, especially in our mobile clinic today. My name is Numair. I'm one of the MEDLIFE students, vice president of my charter at UC Riverside. I wanted to do this interview with you to get to know you a bit more, as well as your contribution, how much you're implementing an impact. May I ask if you can first introduce yourself?
Yeah, sure. I'm Giancarlo Castañeda Montenegro. That's my full name. It's very long in Spanish. I'm a physician. I've been working with MedLife for over 2 years right now. I'm really happy to be with you today, with you guys in general.
Thank you.
Yeah,
Thank you. Definitely, of course. I want to first get based off of your own experiences. What is probably the biggest health challenge that you had to overcome, especially with working with patients in the field that you work in, especially in Lima, Peru, where we were at. Well, we were already in Lima, Peru, but the area where the sector that we were in. What is this particular big health challenge that you had to, figure out or overcome? In that sense, in your own history.
Yes, that's perfect. That's a good question. So when I was in med school, I had different rotations in different hospitals around Lima. I had the public hospital, the army hospitals, and the private clinics also have rotations over there. So each place is different here, and each kind of place has a different kind of patients. So for example, my internship, that is our last year of medical school here in Peru, I did it in a private clinic because I had the idea to go abroad and I have more chances of having to shadow better doctors over there and to have a good network over there. I had a chance to do that, but the difference is when I hit the reality that is Peru, that the vast majority of the persons, around 20% of the person, sorry, around 80% of the person that lives here have public insurance. That's not for all of them here. So the first time I worked in MedLife, I just saw all the drugs we have here, we can use with the patients, and I realized, okay, there's a small list for each one of these. I can work around this stuff. Okay, it's gonna be my challenge. Whenever in doubt, sometimes we don't have the first line film for some diagnosis, but I ask for the patient if they have sometimes money to pay out of pocket for these kind of things. Sometimes they can, sometimes they cannot. But I think the biggest challenge is when the patients are not able to pay out of pocket for some drugs we don't have because it's free for them. How can we help them? For example, I can give you a good example. Around 3 weeks ago, we have this lady that is 94 years old that was living by herself and her daughter. She was prostrated to a bed in a very small place like this one, maybe. Like you can imagine a room with only these two cushions, these two sofas are gonna be the whole bed. And this whole space is gonna be the room. So it was a very small room for her to live. So she wasn't moving around. So she was having this, what do you call it? Pressure ulcers. So because she was not moving from time to time, the doctor wanted to help her, but she didn't have the media that's money for buy some stuff, and she didn't have also the time to help her because she needed to work to have some money and to feed both of them. So in this case, the patient had a dementia, a problem with mobility, and you realize, okay, in the private clinic, I have this same kind of patient. The insurance cover all of it, so we have the best stuff like Duoderm, which is a 3M kind of patch, which can help with pressure ulcers. It's kind of expensive. You realize for the family it's around $30 or $10. It might not seem like a lot for some people, but for these patients, $30 is a lot. It's a lot.
Definitely.
So in this case, for example, we with other trip leader we have this visit to this community. I said, okay, maybe we can arrange something. I can buy the patches. Some of you can buy the cream. We can gather some money to buy a new cushion because the cushion was with flies around it. So maybe because she was wet in the bed and she didn't have the proper protection, she was very wet, a lot of what do you call this? Moist and what do you call this? The black mold around the area. So you can imagine living in those conditions. So luckily we were able to raise some money to buy a new bed, a new impermeable protector for the new bed. We bought the patches and we bought the cream. We were able to gather with help from the community and also from some volunteers from where you come from. And here is gonna receive the donation tomorrow. It's gonna be a big day for us.
Definitely, of course.
But the difference is, to make it summary, sorry,
Hmm.
some patients have different perspectives of life. For example, 30 soles for some else may not sound like a lot, but we have a privilege too. We're able to afford that. For this patient, they don't have the privilege.
Okay, that's very interesting to hear, especially in that particular sense.
Mhm.
I want to ask, like, what symptoms do patients often ignore until it's too late that you've seen?
Headache.
Headache?
Headache. Yes. We have primary, secondary headaches. So most of the cases I'm gonna have primary headaches, but sometimes when you have the worst pain in your head, we have some neurological symptoms like an eyelid that is dropped, and you have numbness or you have low sensation of one part of the body. There's a red flags for coming to the neurologist consultation or to the ER at least. But these patients, in order to go to these places, need time. Sometimes they need to work in order to get money for their day. So sometimes they say, no, it's a headache and that's it. I'm gonna get better with some pills. Sometimes they're just about to have a stroke or something worse than that, like hemorrhagic stroke. So telling them that the health is important, but coping with the lifestyle they need to make to eat, that's one of the biggest challenges we can see here. Also, like when you find a lump on a patient, they miss that because okay, it's a lump, it's gonna be there, it's not a problem. But sometimes these lumps has reflex. They don't know that because they haven't been to a physician in 10 years or more. So they miss that because of education. That's why the part of E of MedLife, education, is very important.
If, of course. And I know you, especially in our communication back over there in that sector, you discussed that a lot of people really focus on going to a pharmacy rather than actually seeing a
Yeah,
doctor.
that's true statistics. If you want the exact numbers, I think 17 or 16% of the people go to take medications gonna go to the pharmacy first. That was on the last census last year in 2025 from whole Peru, you know. Around 35% of them go to the MINSA, which is like the public insurance, and 15% of them go to the Salud, which is like the or another public insurance that is a little bit more funded. Okay, but they prefer the pharmacy because it's close to them, so access is a very important barrier, because it's cheaper. You only pay for the drugs, not pay for the doctor, for the midwife, or for the dentist. You know.
Right. That makes sense. And I want to also ask you, like, what does health equity look like in your practice?
Okay, that's a good question. So, we have inequities in your life. You and I really like when you have
Mm,
not
right.
inequities. For example, here you're staying in a very good district of Peru, that's Miraflores.
Mm-hmm.
But if we go to the borders of Lima, we're gonna realize that there are some places that, I mean, they have a good view, but sometimes they don't have a pavement on the streets. They don't have like stairs to climb up of the mountains.
Right.
Even here in Lima. So what happened here is because those places doesn't gather a lot of taxes. So the public sector doesn't invest a lot of money in that place because they're not gathering.
Yeah.
Because we have a lot of corruption in Peru, sadly. What we do here is try to cope with that. That's why you see that these places around here are more secure. You have a lot of like these district policies are like making rounds around here in Miraflores. It's very safe. But when you go over there, it's different. You don't see a policeman nearby.
Right.
Yeah. So the inequity is there for making them safe.
Right.
How could you imagine living in a place that you? Sorry, how could you imagine living in a place that you don't feel safe? in?
Definitely. Makes sense.
That's one thing. Imagine trying going to the doctor being a luxury. That's another thing important. So there are stuff that could be better here, sorry, and that's from the perspective of public health, like more funding to primary care centers rather than big hospitals, because if you found like you had a good base of primary care physicians all around Lima or around Peru in general, you're gonna have less patients in the big hospital because less complications. But that's an issue that's been going for years since I was in med school, and nothing has changed sadly till this day.
Definitely. And